is Gladys Sanchez, a Realtor, and today I'm interviewing Dr. Alejandro Betancourt. He is a neurosurgeon that services the Valley, and thank you, Dr. Betancourt. I know your time is very valuable, and I truly appreciate the work that you do and your dedication to your patients and helping the people in Brownsville, Harlingen, and McAllen. So here we go. This is the first question, Doctor. What inspired you to become a neurosurgeon? And was there a defining moment in your career that you said, I think neurosurgery is for me?
Gladys, first of all, good evening. I'm glad for you to be here and give me the honor of giving you this interview. Since I was a kid, I was always fascinated with everything that has to do with medicine. My dad was a big promoter for me to become a doctor. That's one of probably the things that influenced the most my father, plus my dedication to take care of people. When I was young, I used to go out, and if I see an accident or a motor vehicle accident, I used to stop and help. I went to medicine, and from medicine I finished my med school, and I become a resident at the University of Puerto Rico in the medical center. I started on general surgery because I want to be a trauma surgeon. And when I did my rotation in neurosurgery and I see what the neurosurgeons can do, saving life, and so dramatic the way that they do, I get very interested. And that's the reason I follow the residency program. I was accepted, and I did 7 years of residency in an accredited program in the University of Puerto Rico in San Juan. And I did, first of all, before that, 3 years of residency in general surgery.
Dr. Betancourt, what is the most rewarding and most challenging part of your job? And did you ever had a patient's case that deeply impacted you on a personal level?
Yes, my most rewarding part of my profession is when I take patient of care and they're very grateful because I saved their life. It made me really feel very good. I specifically remember a patient I did surgery in a tumor on the area of the posterior fossa and the area of the cerebellum attached to the midbrain, which is very important. And I saved her life, and I take out the tumor out, and she recovered from the tumor, but the tumor was malignant, and she came back to the hospital, and I had to do it again. We're talking about somebody about 23 years old, very lovely person, and I had to take it out again. And the third time, recurred the tumor, and I talked to her, and I let her know that it would be very risky to do that surgery. And she was very, very, very grateful for what I did to her. And she told me, thank you, doctor, for what you had done for me, but it is time for me to leave, and only God will be the one that takes the final decision.
Dr. Betancourt, what goes through your mind when you make the first incision?
The first thought I have is about God. I want God to be with me at the moment I do the surgery. I think He's my shepherd. He guides me. He guides my hand throughout the surgery, and I need Him to be next to me. I don't like to be alone in an operating room.
Dr. Betancourt, what is one common myth out there that you wish people stop believing? And also, what advice would you give people to keep their brains healthy as they age? And is it really, really true that we only use 10% of our brain?
One of the biggest mistakes, or I would say big misperceptions about brain and the spinal cord, I have to include both at the same time because they're part of the central nervous system, is that they can regenerate. The nerve that are in the central part of the system, which is the brain and the spinal cord, they cannot regenerate.
What about the advice to keep your brains healthy?
The advice to keep the brain healthy would be the same advice that I would use for everything. Number one, you have to have a good nutrition. You have to try to eat the best you can and the most healthy possible. Number two, you have to keep doing exercise. Exercise is important. You're going to keep the flow of blood to your brain. It's going to keep you thinking, acting, using your brain all the time. And the last one, which sometimes we don't think is important, is rest. If you don't rest, your brain is going to suffer because it's working 24 hours 7. And when they suffer, they're going to happen the same that when you working out for a long time, you're going to have fatigue. And the brain with fatigue is going to have tendency to make mistakes, and the mistakes sometimes are irreversible. and better follow the 3 leads, and try not to use drugs because the drugs can damage brain and the spinal cord injury. Try not to drink because the alcohol also damage the brain as well and produce atrophy of the brain. And the cigarette, because the cigarette predisposes everybody to cancer, to rupture aneurysms, which is the vascular structures inside the brain, and can get you to a disaster.
And what about the question of us using only 10% of our brain?
We use 90%, probably 10%, we don't really use it that much. But the cortex, all the area of the brain, the one that you see in all the pictures, all the cortex is going to be like a big complex network of computers that are going to keep storing all the memories and all the things that you have. If you go to Disney World, it's going to be there. If you go to the movies, it's going to be there. If you read something, it's going to be there. The imprinting of that information is in the cortex. And from the cortex, I'm going to go to different areas. I think it's very important for people to know that. That's the reason we have to take care of our brain, because if we don't take care of our brain, then our memory is not going to be good. And then we're going to go and get dementia and other diseases that are related to brain degeneration. And most of them are related to alcohol abuse, drug abuse, and other things like that.
Dr. Betancourt, can you tell us about the latest research and developments in neurosurgery?
Gladys, there is many advances on neurosurgery. I mean, we're talking about robotic surgery. We're talking about vaccines for Alzheimer's disease. We're talking about spinal cord regeneration. We're talking about complex networks to place devices on the brain to make the arms and the legs to work that they're already being affected by spinal cord injuries. There is a lot of things that are now on the table that are being using gradually. A lot of them hasn't been finalized, but some of them are going to be probably finalized soon. For example,
can you talk to us a little bit about dementia?
Dementia, there is many different types of dementia. The most common one, and everybody is talking about, is Alzheimer's dementia, but we have non-Alzheimer type dementia. The Alzheimer dementia is the dementia patients tend to get aggressive. They lost about recent things. Sometimes they cannot recognize family. We made those diagnoses when the patient died. If we did a biopsy of the brain and we find out that there is amyloid angiopathy, which is a big time unit that relation with Alzheimer's disease, then the patient has Alzheimer's disease. But there's other dementias like multi-different dementias, people that have heart disease, that the brain does not receive enough blood, the tissue die, but those are we call multi-different dementias. We have dementias produced by viruses. We have dementias produced by metabolic issues. For example, deficiency of thiamine. Thiamine in people that now have recent surgery with bariatric surgery, they have a deficiency of thiamine. They can develop dementia related to the deficiency of thiamine that is called communicated dementia. We have Korsakoff dementia, which is more or less the same, related. You have confabulation. You try to confabulate, to try to follow the lead of the doctor when he's making you an interview. All those are deficiencies of vitamins. It's metabolic dementia. There's many dementias like peak disease, dementia produced by Parkinson's. We have to classify the dementia in order to treat it. Unfortunately, most of them, they don't have a cure. Others can be treated.
Betancourt, I'm going to ask you some fun and interesting questions now. What is it that Hollywood always gets wrong about brain surgery?
Well, what I believe is always get wrong is that, for example, they show somebody got a surgery, and the surgery, difficult surgery in the brain, and the patients, they survive, but it's perfectly normal. That's not a true statement. Some people do very well, some people not. Unfortunately, the brain can suffer through a surgery, and that's something that is going to have a sequela. And that patient is going to have the sequela for the rest of his life. And that's probably what I criticize from Hollywood. Try to make everything very, very unrealistic.
If you could operate on a historical figure, which one would it be?
It would be many. One of them would be Benjamin Franklin. I think Benjamin Franklin has one of those minds that there was unique. You have Albert Einstein. I mean, I truly believe that brain anatomy, surface anatomy, had to be different than any other person. It's something that it will be very fascinating. Besides studying their mind and what they think and the way they get to those analyses, it will be important to see, or at least when they die, check that brain and make a slice and check if there's any area of the brain that is more, it's bigger than other areas that makes these people to think that way.
Dr. Betancourt, what made you choose the Valley for your area of practice? What advancements you see in the area coming? And what advice would you give young students that want to pursue your field in neurosurgery?
When I decided to start working as a neurosurgeon and I was finishing my residency program, I got a friend of mine that was in the residency that moved to the Rio Grande Valley, and he told me about the need for good medicine and good neurosurgery in this region because we consider an underserved area close to the border of the United States. And that caught my attention. I really want to start something unique to help people that really need it. And that's what I've been doing for almost 25 years. What I recommend to students is to follow their dreams. And I am a professor at the University of UT San Antonio, and I have students and I always tell them the same: follow your dreams and do what you want to do. Don't let anybody to get in the middle of your dreams and realize that you are the only person that can change your destiny.
How do you see the medical field evolving here in the Rio Grande Valley in the next 10 years?
The medical field has evolved significantly. Today's day we have more equipment to perform more complicated surgery. It's less the referrals that we do to major university hospitals. I think that we can handle pretty much everything here. We have a trauma level 1 in the valley, which never had that before. We have a stroke center in the valley that we never had before. And we have more numerous neurosurgeons in the community that are doing their work too.
Dr. Betancourt, how can people learn more about your work and how can they connect with you?
Gladys, my location is in 597 West Sesame Plaza at Suite D, Harlingen, Texas. Our phone number is 956-425-3706. We have office hours from Monday, 8 o'clock to 5 p.m. to Friday, 8 o'clock to 5 p.m. And we are available by phone with an answering service. Every time we get that need for any emergency, we can respond to answering service. By the same token, we have a website that is Alejandro Betancourt MD.com available with some information about my practice. I perform different kind of surgeries, including lumbar disc herniation, lumbar spinal stenosis, cervical spinal stenosis, peripheral nerve injuries, brain tumors, tumors in different areas of the spinal cord. I also do Parkinson's surgery. I also do brain tumor biopsies with stereotaxis, minimal invasive. I perform minimal invasive surgery, kyphoplasties, vertebroplasties, the one that I use to place cement for fractures without the need of major surgical intervention. I do significant amount of trauma to the brain, to the spine, to the cervical spine, to the lumbar spine, to the sacrum. Also, I do complex spine surgery as well as scoliosis. And we perform radiosurgery available, things that we are doing for many years, for almost 25 years in the area of the Rio Grande Valley.
Thank you, Dr. Betancourt, for giving me your time for this interview. I know you're a very busy man, and if you are interested in buying, selling, or investing in real estate, contact me, Gladys Sanchez, Realtor, 786-495-6755.
We do.